My name is Mary. I'm the Director of Hospice at Aspire Home Health and Hospice, and we're so excited to have you on our team. I'm just going to talk a little bit about the orientation process as far as what we do in hospice, just a very brief overview of what we do here. The first concept is death and dying in general. Regardless of a patient's terminal diagnosis, most of our patients follow similar patterns. They go from stages, from the transitional stage to actively passing stage, and there are different symptoms that go along with every stage of dying. We do have a pamphlet called The 11th Hour, and that is a really wonderful resource that we will give you so that you can familiarize yourself with some of these symptoms as someone is getting ready to pass away. So next is psychological and spiritual issues related to death and dying. So it's actually a Medicare requirement that all hospice companies have chaplains and social workers as part of the care teams. And here at Aspire, we embrace spirituality and the importance that it provides in people's lives and the comfort that it gives them, especially at a difficult time like when someone's getting ready to pass away. Families or patients may decline to use those services, but it is required that we have them and that they are available to our patients and to their families. And it makes sense, as someone's getting ready to pass, there are a lot of emotional issues or psychological struggles, a lot of family dynamics, and so it's really important that we have the chaplain and the social worker on our team. They're really good at providing resources and helping families and patients work through some of their struggles. Grief and bereavement. Grief and bereavement obviously play a very important role in hospice as someone is getting towards the end of their life, and family members can have anticipatory grief. So it's not just after a patient passes, it's during the whole process of the hospice experience. And at Aspire, it's important for us that we address grief and bereavement. So when a patient is admitted, our social worker will do a bereavement assessment within the first 5 days of the patient's admission date, just to understand a little bit more about maybe what they're struggling with, what their strengths are, what they need help with, if there are certain resources that can help the family. It's important that we at Aspire think really hard to anticipate the needs of some of our patients and the family members, and the better we get to know them and what issues they may have, what things they're struggling with, this will help immensely through the grieving and bereavement process. Communication skills with dying patients and or families and caregivers. It can sound a little bit daunting to have conversations with family members, especially regarding death. It can sometimes be a struggle to talk to someone about their DNR, their do not resuscitate orders, if they want them or if they don't. So that's something that we work really hard to train and teach our clinicians on how to set boundaries with patients and families, how to communicate well with them, to be direct but full of compassion and empathy. These are all really important skills that we learn at Aspire. Pain and symptom management in palliative care. So at the end of life, we see a lot of similar symptoms. And so when a patient comes onto service, we will automatically order what's called an E-kit. And that has as-needed medications in it, morphine, lorazepam, Zofran, medications that kind of run the gamut of the symptoms that we see at the end of life. So pain, anxiety, shortness of breath, constipation. We will send out medications to assist that patient and the caregivers, and then we provide information on those medications as well so that they know how to give them, they know what dose to give their patient or their loved one. We also try to use non-pharmacological interventions as much as possible. We have music, so we have a wonderful harpist who will come play for our patients and their families, and it really does relieve a lot of anxiety. We also have a massage therapist and a therapist who does craniosacral integrative touch therapy. So we really do try to take a holistic and spiritual approach while also using medications to control symptoms and keep patients comfortable, because that's the whole goal in hospice, is to keep patients comfortable. Concepts of stress management for hospice personnel involved in caring for dying patients. So obviously, caring for a dying patient can be a little stressful. However, here at Aspire, it is our goal and our mission to turn all of our people into teachers. And that will help relieve the stress in your life if you're feeling overwhelmed about your position in hospice, because we have formulated the perfect visit, and that will make you successful. You will not forget your medications, you will not forget supplies, you will know what your patient's biggest concern is. The perfect visit was designed to make your life less stressful. It was designed to give you a life so that you don't feel like you're just running around like crazy for patients. And it can be difficult in hospice. You know, you'll have 3 patients starting to decline at the same time, and that can be, it's hard to juggle that when you have to make extra visits or you have to change medications, and that's why you fall back on that perfect visit and the things that you learned and that you know about the perfect visit, so that when it does get stressful, you know where to turn. And you also will have a really good support system. We take care of each other here at Aspire, and we all jump in to help when needed. Handling of a death in the home. So when a patient passes away, a hospice nurse is required to go attend the death. That doesn't mean that they need to be present when the patient passes. All it means is that a nurse does need to show up just to verify that the patient has passed. The nurse will then contact the funeral home that the family's made arrangements with already. They will ask who the name of the doctor is who will be signing the death certificate, and that will always be one of our medical directors. And every family is a little different, but some families are so grateful to have you there, and they want you to stay and help perform post-mortem cares. Sometimes that just includes changing a brief or putting on new clean clothes, just for the dignity of the patient. Sometimes family members, they just want to be with their loved one, and they just want you in and they want you out, and that's fine too. When a patient passes in the home, there are medications, there are narcotic medications in the home, and we need to ensure that those get destroyed, because we don't want morphine and lorazepam just in everyone's home. So there are certain procedures that take place when a patient passes, but it's really kind of a unique and beautiful experience, especially if you've got to know your patient and that family. They really will rely on you to help them through that. We're really excited to have you at Aspire, and if you have any questions, you have a wonderful team of people who are always there and willing and want to help you grow.